Hey everyone, this is Mike, and today it's going to be how would an interpersonal therapy therapist treat ADHD? I'm just kind of returning back to ADHD because I wanted to include this one on here. Um, so, interpersonal therapy, or IPT, is a time-limited, structured psychotherapy that focuses on improving a person's interpersonal relationships and social functioning to alleviate psychological symptoms. While not a primary treatment for ADHD itself, which often benefits from behavioral therapy, medication, and skills training, IPT can be a highly beneficial treatment for individuals with ADHD who experience relationship challenges or co-occurring mood disorders like depression, which are common with ADHD. Here's how an interpersonal therapist might approach treating someone with ADHD. So one, assessment and formulation. Interpersonal inventory. The therapist would begin by creating a comprehensive interpersonal inventory with the client. This involves mapping out all significant relationships, family, friends, romantic partners, colleagues, and identifying areas of conflict, distress, or unmet expectations. Connecting ADHD to interpersonal issues. Crucially, the therapist would help the client understand how their ADHD symptoms, inattention, impulsivity, forgetfulness, difficulty with emotional regulation, poor time management, contribute to their interpersonal difficulties. For example, forgetfulness leading to missed appointments or forgotten promises, straining relationships. Impulsivity resulting in interrupting others or making hasty comments causing conflict. Difficulty with emotional regulation leading to arguments or misunderstandings. Challenges with organization impacting shared responsibility in a relationship. Identify problem areas. IPT typically focuses on one or more of the four main problem areas. Grief, addressing unresolved grief that might be impacting current relationships. Role disputes, helping to resolve conflicts arising from differing expectations in relationships. Role transitions, supporting the client through life changes, for example, new job, new relationship, parenthood, that are creating stress and interpersonal difficulties. And interpersonal deficits, addressing chronic difficulties in forming and maintaining relationships. Treatment strategies and techniques. Communication analysis. A core IPT technique involves analyzing communication patterns. The therapist helps the client identify how their communication or lack thereof contributes to problems. This can involve clarification, helping the client articulate their feelings and thoughts more clearly. Role playing, practicing difficult conversations in a safe environment to develop more effective communication skills, assertiveness, and empathy. Analyzing communication breakdowns, identifying where misunderstandings occur and how to improve. Emotional expression and regulation. Encouragement of affect, helping clients to identify, acknowledge, and express their emotions in a healthy way rather than letting them build up or manifest in unhelpful behaviors. Understanding the link between emotions and relationships, recognizing how emotional states impact interactions and vice versa. Problem solving and skill building, developing coping strategies. For managing the impact of ADHD symptoms in relationships. For example, if forgetfulness is an issue, the therapist might encourage the client to use external reminders or communicate their challenges openly to their partners. Social skills training. While not solely IPT, an IPT therapist might incorporate elements of social skills training relevant to the client's interpersonal goals, such as active listening, reading social cues such as body language, tone of voice, and initiating conversations. Boundary setting. Learning to establish healthy boundaries in relationships to manage expectations and prevent conflict. Focusing on the here and now. IPT primarily addresses current relationship issues rather than delving deeply into past traumas or developmental history, though these might be acknowledged if they inform current patterns. The emphasis is on tangible improvements and present-day interactions. Support and psychoeducation. The therapist acts as a supportive and hopeful guide, providing psychoeducation on ADHD and its impact on relationships, and helping the client to identify and leverage existing social support networks. Termination phase. The final session focuses on reviewing progress, consolidating learned skills, and preparing the client to manage future interpersonal challenges independently. This also addresses any feelings of loss associated with the end of therapy. Specific considerations for ADHD, impulsivity and conflict. For individuals with ADHD who experience impulsive outbursts or arguments, IPT can help them learn to pause, regulate emotions, and communicate more thoughtfully during conflict. Inattention and misunderstanding. By improving active listening and clarity in communication, IPT can reduce misunderstandings that stem from inattention or difficulty processing information in real time. Forgetfulness and relationship strain. The therapist can help clients develop strategies to manage forgetfulness within relationships, using shared calendars, setting reminders, open communication about challenges, and to take responsibility for their impact on others. And low self-esteem and social withdrawal. If ADHD symptoms have led to feelings of inadequacy or social isolation, IPT can help build confidence in social interactions and encourage the client to engage more positively with others. It's important to remember that IPT is often used in conjunction with other ADHD treatments such as medication, executive function coaching, and more broad-based behavioral therapies to provide comprehensive care. So what are your thoughts? What are your thoughts about how IPT can help with ADHD in which you want to be treated with this kind of therapy? Put your comments in the comments section. I look forward to speaking to you next time. Bye-bye.